So many people in this city, adults and kids, are getting ear infections in the last month. With the allergies and URIs, it's almost inevitable. Also known as otitis media, the symptoms are fever, ear pain, and a feeling of fullness in the ear, as well as fussiness and feeding problems in young children. Bottle feeding, when the child is lying on his back, increases the risk of ear infection in babies, and also exposure to cigarette smoke is a risk factor. Otitis can cause temporary hearing loss and can be caused by viruses or bacteria. Acute otitis media is usually of rapid onset and of short duration, and chronic otitis media is a persistent inflammation of the middle ear, typically for a minimum of a month. Following an acute infection, fluid may remain behind the eardrum for up to 3 months before resolving. Severe ear infections may cause the eardrum to rupture. Young children tend to have more ear infections than adults because the canal that runs from the middle ear to the back of the nose and throat, called the eustachian tube, is shorter and more horizontal in young children. But if you're an adult, whenever you have increased congestion, like when you have a runny nose from allergies, then you can get an ear infection as well. There is no definitive lab test for acute otitis media, and the treatment varies depending upon the age of the person and the symptoms. There are always a few ways to deal with these nasty ear infections. You can start antibiotic treatment, or you can just observe, also known as watchful waiting, which is based on age and severity of illness. Observation is an appropriate option only when follow-up can be ensured, and antibiotics can be started if symptoms persist or worsen. If antibiotics are initiated, amoxicillin is usually recommended as the first line of treatment. This is usually prescribed for 10 days. Even after antibiotic treatment, 40% of children are left with some fluid in the middle ear, which can cause temporary mild hearing loss lasting for up to 3 to 6 weeks, and this fluid usually just disappears spontaneously. Ceftriaxone injections are recommended for patients that cannot take oral antibiotics, and if you have recurring bouts of otitis media, you should be referred to an otolaryngologist. Patients may benefit from having ear tubes surgically placed to permit fluid to drain from the middle ear to decrease the number and the severity of recurring ear infections. And oh yeah, there are no proven home treatments for ear infections, so don't delay that treatment while you're waiting on grandma's new remedy. So if you are sniffling and you start feeling like you have some fluid in your ears, then you need to get it checked out immediately by a doctor. I'm medical editor Dr. Corey Hebert with your Weekend House Call.